I'm Dr. Drrodrohrich, board-certified plastic surgeon in Dallas, Texas. Welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. And today, let's talk about the hot topics in facial rejuvenation. How deep is the deep plane and beyond? And I'm here with a world expert on facial rejuvenation, Dr. Steve Cohen from sunny San Diego. How are you doing, Steve?
I'm great, Rod. Thank you.
Good. So, facial rejuvenation, it seems like everybody wants a facelift now. In fact, there was a New York Times article talked about getting a facelift at age 35. And I'm going, really? So I guess, if you ask for it, do you really think you should have it? Maybe, maybe not. So tell us about, Steve, what's the interest today and why is it so hot to have patients ask for facial rejuvenation? Because it's not just surgery, it's so much more than that, right?
Yeah. I think the trend, Rod, is earlier facelifts in part because we're failing patients with energy-based devices. They're not getting the results that they see in the books. Two, we're overfilling faces to compensate for things like laxity that are not treated by fillers. And we're finding out these fillers that we were told we can dissolve and are going to go away never go away, which is very frustrating that the FDA has not started to look into this. Because I think, we were worried about something like Artifil or Belafil being permanent. And now we're finding out HA products that are heavily cross-linked are virtually permanent.
Right.
So I think that younger patients are better educated in many ways and are looking for things that are going to be more effective ways to spend their money, because you spend $5,000, $6,000, $10,000 on a minimally invasive thing that you go, I see a 20% improvement, maybe. It lasts a year to two, maybe. And I just spent good money and I'm disappointed. So why do that if I now am seeing all over Instagram the most beautiful facelift work that's ever been done in the world of plastic surgery? Well, so I don't know. I'm non-denominational. I go, look, I don't care your age. It's your physical findings. Here's our tool chest. And if these are the things that make sense to you, this is the way you could proceed.
Yeah. No, I agree. I mean, that all makes sense. But, I just saw a 30-year-old patient who came in for a rhinoplasty today. And, she's got the typical, LBG1, and, she's had the Ozempic face because she's lost like 40 pounds. And she wants her nose done. And she said, oh, by the way, what do you think about having a facelift? And maybe I'm old school. And, yes, she has skin laxity. I mean, she looks like almost like a 40-year-old. And I just said, I told her, everybody's, and I agree with you about not doing, it's not by chronological age, it's your actual aging. And, she did have some skin laxity, but she had more volume loss. So I'm going to treat the volume loss first. And I don't think she had enough laxity for me to do a facelift. So tell me how you sort that out, because if they have volume loss and skin laxity, I think they're reasonable to proceed with a facelift. But I don't just shotgun them at 40, 35.
Totally agree. And to the same extent, if somebody comes in at 65 with tight skin and they've had 2 facelifts and they want another because, they can't stand the fact that, after their last one, they have laxity, which I don't see, and they do.
Right.
To me, go away, come back another day when you need it. You don't need it, period.
I agree.
So to me, it's just evaluating each face individually and saying, regardless of age, here are the physical findings. Now, with Ozempic face, that is very interesting because I do think even as a staged approach, replacing the fat, re-stimulating the skin because you're losing the fat under the skin, the dermal white adipose tissue almost differentially.
Right.
I think that makes a lot of sense to me, to stage those kinds of things. And if somebody has minimal laxity, with fat grafting alone, they're going to see tremendous improvement because you're refilling the face, but you're doing it in a way that is appropriate for their anatomic need. And voila, at the end, you have a beautiful face and the laxity is less.
Yep.
So I think it depends on the degree.
Right, I agree. And that's why I think so many of these articles and on Instagram, there's so many broad strokes. It really comes back to analyzing the face, understanding the science of aging, and then using the tools appropriately to give that patient the best result, not just shotgunning him and saying, I'm going to do a deep plane facelift. In fact, let's talk about the deep plane. Is the deep plane really revolutionary?
Well, talking about ChatGPT, first of all, you're right about ChatGPT. If there's junk in, there's junk out. So if ChatGPT, if you ask him, search all the facelift techniques, tell me which one is best, it's going to come back and tell you there's not enough data to tell you any of these are better than the other, period. And we all know in a good surgeon's hand, in the right patient, just doing skin and plication can lead to beautiful long-term results, or a very simple removal of a little SMAS tissue. On the other hand, I look at patients with significant jowling, and the mechanism is you're attached at the zygoma to the bone, you're attached at the jawline to the bone, but everything over your masseter muscle stretches and produces your jowling. So if that's significant, I think there is a role to reposition that by doing a deep plane or a SMAS styled facelift. And to me, the differences are more semantics. I think for patients, again, go to a surgeon who has gorgeous results, and who cares whether they do a SMAS or a deep plane or anything if you love their results. On the other hand, from a purely anatomic point of view, I like the deep plane to reposition that aspect. But you can do it with the SMAS. It just you're not at the money as fast, but both are very nice.
Yeah, no, I think you're right. It is doing some type of deep layer facelift is important today. I think just long as, like we talked about in an earlier podcast, facial fat grafting is an essential part. So is a deeper layer facelift. It has to be part because you're lifting and filling. Now, is the deep plane the ultimate answer? It's certainly an older tool that has been modified somewhat, but the important point is you're doing something to mobilize the mobile part of the face, the part that moves. And I think the difference there to me is not necessarily how deep you go, but how far you dissect anteriorly. So it's a little bit of a misnomer because, you can only go so deep without hurting the patient's facial nerve, but it's how far you dissect anteriorly. For the lay person, it's this part of the face that's mobile and how much you're dissecting in front of that. And is that mobilization truly helping your longevity? And I think we just actually submitted an article to our journal on that, and we're finding that, it's like you said when you asked ChatGPT, there's no superior facelift technique. There are surgeons that actually do good facial rejuvenation based upon the aging that is the most important. But it's been hyped up a lot on social media. I get asked every day, do you do the deep plane? Because people don't even understand it.
I know. It's the same thing with vertical lifts. Somebody trademarks vertical lift, and everybody comes in to do a vertical lift. And I said, well, that's the way all of them are done. They all are vertical lifts, but whatever. I guess I can't ever figure out a really catchy trademark name. So I've never done that because I kind of agree with Fouad Nahai. There's not a facelift for all seasons. So you need to adjust based on the patient's appearance. And that's why there's not a superior facelift technique. There are superior surgeons doing facelifts.
That's exactly right. That's a superb phrase. And that's so important for the viewer. You need to seek out somebody who's actually a superb surgeon. Look at their results, not only on their website, but also online, and actually see their videos of their patients. That's the most important thing. You see how they're animating. And nobody's perfect. Just like you, I see everybody's facelift results, just like they see all my rhinoplasty results, and everybody's human. And some results are good and some results are not so good. And that's just called being part of the spectrum. But choosing the right patient and the right technique and the right surgeon, I think, is the gold standard. And I think you're so right. I mean, I always worry about, when people or patient or, or you're trademarking anything, especially in surgery. I mean, it's hard to trademark anything because, we're here to actually teach others and to tell them what works and what's safe. Don't you think? Because I am seeing a lot more complications when I see patients that have had the quote unquote deep plane than ever before, at least in Dallas. And I wonder what kind of facelift they truly had.
Well, part of the problem is the learning curve for surgeons can be
Long.
unfortunately a little tricky for patients. And so you have to be a capable surgeon, confident in your abilities. And when I say confident in your abilities, if you feel you're not going to be able to deliver these results safely, don't do it.
Right.
I mean, you're going to still get very nice outcomes, just don't do it. Or if somebody really truly needs things out in their neck and this and that, send them to your colleague who does it. I mean, we still are here to take care of patients, not simply to make, livings.
Yep. No, I agree. And, don't do crazy stuff and be safe. Yeah, and don't work outside your safety zone for facial rejuvenation. And I just think that is a word of caution because everybody today, it's so funny when I look at Instagram, everybody I know what they're doing and they're saying, I'm doing a deep plane. I'm going, really? I guess it's a deeper layer facelift, which makes a little more sense, but don't do crazy stuff. So
I don't think any patient would be able to look under the covers to see whether they did a deep plane or a no plane.
Exactly right. And sometimes we do see some of these patients and we do look under the cover and it doesn't look like anything was done, but that is it, what it is. So give us your top 3 take-home points for the viewer when one wants to see someone to get a great result, a safe result, and a natural result. Those are the cornerstones of facial rejuvenation.
So I think one, if you have friends that have used a given surgeon, it's always helpful to have friends that you see and you like their work give you a perspective,
okay,
because they'll tell you some insight about the personality of the doctor, the way the office functions, etc. 2, I think look at the doctor's results across a broad spectrum. Even look at breast surgery and tummy tucks, this and that. Get a feel. Does this doctor have a good eye for what they're trying to accomplish? Because, ultimately you want to look beautiful. And if you see a doctor who's producing beautiful results, that could be the doctor you want to see. And just as an aside, I remember when I was training in general surgery in New York at Columbia, there was one surgeon, you could not even follow what he was doing in the abdomen. But when he was done, it was the most beautiful thing you ever saw. So you really need to find someone who is more gifted in their outcomes and concentrate on what their website really looks like. And look at a lot of people, because you're going to see all of us have grand slam results, but look at a broad array,
right,
because this is reality. We look different. We have different tissues. I wish I was an engineer. I wish you were fabric. It'd be wonderful. We wouldn't even have half the discussions about outcomes that we do.
Right. It's wise words from a wise plastic surgeon, and I think that is so true. Know before you go. Find a highly skilled and talented plastic surgeon that cares about you first and foremost, and deliver safe and consistently good to great outcomes. I think that's the secret. It doesn't matter the plane, it's also about the surgeon that really matters the most. So thank you again, Steve. That's awesome. It's always great. You always give great, prudent advice. And so know before you go, find a wise and great plastic surgeon like Dr. Cohen in San Diego. Till next time, give us your thoughts, give us your comments, and stay safe and stay educated.